Hello, everybody. My name is Dr. Abbass, and I'm a consultant physician, endocrinologist, and diabetologist based in Dar es Salaam, Tanzania, East Africa. I'm a president-elect of the Food International. I'm a regional chair of Africa and a chairman of Pan-African Diabetic Food Study Group. Today's topic, which I'm going to give at this conference, is diabetic foot wound examination and ulcers assessment. The key factors just to contribute to the scoring of classifications are three types. They are the one which are patient-related, for example, end-stage renal failure. They are the one which are related to the limb, peripheral arterial disease, and loss of protective sensations, that is peripheral neuropathy. And they are also related where you look at the area, depth, site, single or multiple or infection. So site of ulcers, area, depth, single or multiple lesions or infections. Particular system considered for each of the following 5 clinical situations. We need to, this is very important, we need to communicate among the health professionals, predicting the outcome of each and every individual ulcer as an aid to clinical decision making for an individual case, assessment of wound with or without infections, peripheral arterial disease or peripheral neuropathy, and audit of account in local, regional, and national population. International Working Group of Diabetic Food recommends for communications among the healthcare professionals, the use of Sinbad system is the best. Number 2, no existing classification for predicting the outcome of individual ulcers. The infectious disease of society and International Working Group both assess the infection, which is very well good, and Sinbad classification for the audit of the outcome of the population. Obviously, Wi-Fi, that is wound, ischemia, and foot infection system for the assessment of peripheral arterial disease. In summary, the take-home message for prevention is regular inspection and examination of the feet and footwear, identification of the high-risk patients, which is very important, and I've already mentioned peripheral arterial and peripheral neuropathy, education of the patients, family, healthcare workers, and as a whole, appropriate footwear, which is always neglected in our part of the world, and treatment of non-ulcerative pathology. Thank you very much.